Imagine watching your state ranked last in health in America and also on the lower end for vaccine uptake, and they say, let's stop promoting mass vaccination. That is exactly what the Louisiana Health Department just said. And here's why this is a huge issue. The state surgeon general announced that Louisiana will no longer promote mass vaccination, citing personal choice as the priority. And this means no more public health campaigns, no outreach at community events. Vaccines will remain to be discussed with clinicians on an individual basis. And this sounds great in theory, right? Discussing with individual doctors, something we do. Sure. But like all public health campaigns, this decision will hurt low-income families, rural communities, and racial and ethnic minorities the most. These populations rely on public health campaigns for vaccine access and education. Most public health policies in our country do, such as fluoride and water supplies. Without mass promotion, barriers to vaccination, lack of awareness, limited healthcare access, and financial constraints will only grow. Low-income families have lower rates of seeing clinicians due to transportation, childcare, and scheduling issues. They rely on community initiatives and education to educate them on vaccination and provide them. I live in Florida, and many of my patients sometimes use community and government programs to get vaccines before they find their way to private practices. This policy shift is particularly concerning given Louisiana's poor track record during the COVID-19 pandemic and health in general. The state ranked among the top 10 in COVID-19 deaths, with over 19,000 fatalities, a staggering 4,000 deaths per million residents. And Louisiana consistently ranks last or at the bottom in health rankings in America. Calling vaccines a personal choice is a convenient way to ignore the fact that public health decisions don't happen in a vacuum. They impact entire communities. And this policy right here, this is exactly why so many of us are alarmed. Because let's be real, policies like this don't just happen. They systematically leave lower income communities sicker, less informed, and more vulnerable. And at some point you have to ask, is that the goal? Is that what these decision makers want? Because if you had even the bare minimum understanding of public health, you'd know that it means ensuring access to both healthcare and education for everyone.